everyone, I'm Krista Stevenson, Communications Coordinator with PREVNet. Joining me today is Erin Laverty. She's a Project Officer with the Canadian Public Health Association. Thanks for joining me today, Erin.
Thanks for having me.
I'm looking forward to hearing more about your program. So what can you tell us about it?
So for the Canadian Public Health Association's project, we're working closely with the Centre for Sexuality on their comprehensive relationship and sexual health education program, or RSC program for short. The RSC program is an evidence-informed program that has been delivered to youth in Calgary and surrounding areas by sexual health educators at the Centre for Sexuality for several decades. Throughout our project, the RSC program is being adapted, delivered, and evaluated as an approach to support the development of healthy relationships and the prevention of youth dating violence across Canada. At the outset of this project, we've reached out to young Canadians to hear their perspectives on how to create a more positive and impactful sexual health education learning experience for them. And currently, we're working with 4 different organizations across the country to support these organizations to deliver the program to youth in their varying school and community settings. Throughout the duration of the project, we will be evaluating the program by hearing from both the youth participants as well as the RSC program facilitators.
Thanks, Erin. Can you share with us some successes you've had this year?
Absolutely. So we're really excited about the number of Canadian youth that we've engaged with throughout this project so far. We've had a large number of youth participating in 12 focus group sessions and 1,500 youth completing an online survey where we heard about their experiences with sexual health education in Canada. We're also really excited to be working with our collaborating organizations who are from Ontario, the Yukon, and Manitoba, and to be able to support them with the RSC program delivery over the next few years. We will soon be sending out a second call for applications to add more collaborating organizations in the upcoming year. If you're interested in working with the Canadian Public Health Association in delivering and evaluating the RSC program in your own community, then definitely keep an eye out on our website in the upcoming few months.
Now that things are starting to move again after the shutdown, how are you moving forward with your project during the pandemic?
Our project has continued to move forward through 2020 during the current pandemic. We have adapted to the current situation by making the necessary adjustments when needed, while keeping other aspects of the project unchanged. While the RSC program content remains unaffected, we have moved some other aspects of the project online. For example, we've moved the facilitator training and some of our evaluations to a virtual format. Based off the varying regional guidelines, some youth may also be participating in the programming online as well. Overall, the project is maintaining the core components of the curriculum content while ensuring a welcoming learning space regardless of the delivery format. We're grateful that our collaborators are open to adapting based off the public health requirements in response to COVID-19. And finally, I'll note that because the evaluations of the program are an important part of the project, we've also made sure to update the evaluation tools to ensure that we consider the different delivery formats, so in-person or online, when examining our findings. And overall, we're doing our best to be flexible and keep an open line of communication with our collaborators, and we're remaining optimistic as we continue to work on our project.
I wish you and your project all the best. Thank you so much for taking the time to talk to me today. It was so great to learn more about your project.